Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based, fact-based answers to your weight questions, you're in the right place. Welcome. As a caveat, of course, I can't answer personal medical questions because I'm not your personal doctor. So if your question is a little personal, I'm going to change it so it's more broadly educationally applicable, and let's just dive right in. First question. Okay, I am on 2.5 of compound tirzepatide. I am ending my third week. I've had no weight loss and have some same food noise, no side effects whatsoever. Okay, so I have a lot of patients that present in clinic. They're not on compounded medications. I only use the FDA-approved versions. I don't have people on compounded. I've talked about that a lot, but I do have people who, I see them a month after they've started and they say, nothing's happened. What's going on? But that's not, if somebody's on the lowest dose, I'm not worried about that. A lot of times the patients are worried, but I'm really not. That dose is really just to help your body get adjusted. So if I had a patient like that, I would not be alarmed. I would not think it's not working. And also I have people who come see me when they've been on compounded medications and they want to transition to the FDA-approved medications. And for those people, especially if they're not really seeing any effects yet, I always like to see how that's going to change when they're on the FDA-approved medication. So another reason just to try the brand name Wegovy, the brand name Zepbound. I'm not paid by these pharma companies, just FYI, but I think it's another good reason because that's the problem with compounding in addition to safety concerns is you can never quite be sure of the efficacy, if it's going to work. A lot of times people get B12 mixed in or other additives that, probably are not needed. So if I have patients like that, they're not losing weight at that initial dose, I'm not worried. Next question. Could you talk about visceral fat and fat that's in the abdominal area? It's often said that belly fat is the worst fat, but when we lose or gain weight, we can't make fat increase or decrease in particular areas. Is there anything we could actually do, and how would we know if belly fat is visceral? Great question. Visceral fat is the fat, if you think about the abdomen, there's the superficial fat, the subcutaneous fat that you can touch. And then there's your abdominal wall, like your muscles. And then there's fat in and around your organs. So deep in the abdominal cavity, near your liver, near your intestines, near your pancreas, you can store fat there. And that is called visceral fat. And that fat is very bad. Excess fat essentially functions as an inflammatory organ, and you really don't want extra inflammation near your liver, near your pancreas, near your gallbladder, near your intestines. You really don't want a lot of that near your vital organs. And so that's why visceral fat is so harmful, is that it can increase the risk of a lot of other medical issues such as type 2 diabetes, fatty liver disease, things you don't want. So yes, visceral fat is bad. We want the least amount possible. And also correct, we really can't spot reduce fat. So one way to decrease it is just decrease the overall amount of fat that you have. And a lot of times the GLP-1 medications are going to help with that too. There's a very small body of evidence that suggests that intermittent fasting may be helpful. I only think intermittent fasting is a good idea if you really feel like it's compatible with how you live and you really like how it structures your day or your week. If you love intermittent fasting, and there are people who do, they're like, yeah, I hate breakfast. This is perfect. then that might be an added benefit. You may find it slightly decreases your visceral fat as well. The evidence isn't overwhelming, but now in terms of checking your visceral fat, really the best way to do this is through a DEXA scan. You can get these done commercially. Bioimpedance scale is going to be the second best option, but it doesn't really give you as much information as a DEXA scan is. If you really want to know about visceral fat, I would just go straight to a DEXA scan. And I've made a video all about those, so I will leave that down below. But that's going to really give you a great idea. You can check it again in 6 months, see if it's changed, but that's really the best way to track it. So what a great question. Thank you so much. This next question is, anyone who wants to lose weight, wants to look better, if they say they don't, they're lying. It just might not be on the top of the list of reasons they've started weight loss medication. I've lost 36 pounds in 12 weeks on Mounjaro and exercise, and I'm definitely doing it to look better. Unfortunately, Mounjaro has become a pain to get hold of in the UK, and it's going to get a lot more expensive from September on, so I'm thinking of microdosing or changing to Wegovy. Okay, so I just wanted to address this because I think it's a really good point, and I think, you know, a lot of people, they want to lose weight to get healthy, but they also want to do it to look better. And for me, like, that's nothing to be ashamed of. We do a lot of things to look better. And so, you know, while for prescribing, it's very important for me that people are meeting the proper criteria. This is not a medication that I prescribe if somebody has a BMI of 20 and wants to lose 5 pounds. I don't think the benefits outweigh the risk in those types of scenarios. However, for people who meet the BMI criteria, I think if you want to look better, that's fine. You're gonna feel better, and if you feel like getting your weight down to a safer place is also gonna help you look better, like, it's not illegal. I think when I talk to people a lot, they're like, I wanna feel better, I wanna be healthy for my kids, I wanna be around long enough, and those are really good reasons. Those are excellent reasons. And I also think it's okay. I'm never gonna shame somebody for saying, also, I wanna fit into the clothes that I could wear 5 years ago. Like, it's not illegal. It's totally fine. And if that's you, it's okay. And you don't have to tell people that either. But, you know, I just feel like there's so much like stigma and shame about these medications. And we do so much because we want to look better. We dye our hair, we get surgery, we get fillers, we exercise, like so many, like this is another thing that we have available for the appropriate category of people that, in addition to helping them get healthy, may help them to achieve an aesthetic result that they are looking for. And I don't think there's any shame in that. Next question. What if you're in a stall for months and months? I've been in a stall since January and I don't seem to be able to lose any weight. So how do you break your stall? I'm on 15 milligrams, I think, of tirzepatide. Should I get off for a few months, for a few weeks and start all over? What can I do to break the stall? Great question. Okay. Are you in a stall or are you just at the limit of where the medication is going to take you? Because and I can't answer personal medical questions, but for a lot of people, if their weight is not moving for a long time, for months and months, and they're at the highest dose, usually that's a good sign that that is kind of the end of the line in terms of where the medication is going to get them. And for those people, I'm also always calculating, okay, what is the total body weight loss? If I have somebody that their weight hasn't changed, they've lost 17% of their total body weight, and we're very happy with, you know, the lifestyle changes, and they're not on any medications that could be interfering, like that's probably as far as a medication is going to get them. So for anybody out there, if you're thinking that you're in a plateau or a stall, double check, because it might not be a stall. It might just be where the medication, it might just be your new normal, which is fine. Not a problem. Not a problem. The medication keeping somebody at a new, healthier weight, that's fine. But I would definitely check in with your doctor, see what that total percent body weight loss is, because that's really going to tell you Are you not achieving the expected results? Or maybe you have and it's not working. It's working very well. It's just not going to work any further than that. So I think that's a really important distinction for people to make. That's going to do it for today. Thank you so much for watching. If you have questions afterwards, you can definitely leave them on this video or in another video. I will find them and add them to the list. If you are already on a GLP-1 and you feel like you're leaving results on the table because your eating isn't where you want it to be, or your exercising isn't where you want it to be, it's not consistent, you feel like you can't get yourself to strength train, lots of things are coming up, we can definitely talk, because I do work as a life coach to help people with the non-medical aspects of weight loss. Medications can't do everything, unfortunately. So if you are struggling with that, I will leave all that info down below. Thank you so much for watching. If you're not subscribed to this channel, subscribe, and please be well.